Back tonight, and thanks for staying on. In Focus continues. The National Health Department has provided Eskom with a total of 212 priority hospitals across the country to be considered for possible exclusion from load shedding. About 67% of them are supplied directly by municipalities, while Eskom supplies the remaining 33%. To date, the number of hospitals exempted from load shedding has risen from 37 to 72. It comes after reports of forced postponement of life-saving surgery and threats to operational safety of health facilities amid record-breaking incidents of load shedding as the power utility Eskom battles multiple challenges. Joining us now for an update on hospitals and load shedding is the National Health Department spokesperson, Foster Mogale. Foster, good evening. Good to have you with us, and thank you very much for your time. 76 from 212, not a good number, certainly. How is this list populated, and how do you decide who will be exempt?
Good evening, Tawo, and good evening to your viewers, and thanks for this opportunity. Yes, to us, it's a great progress. Remember, we've reported last 2 weeks ago when Minister of Health, Dr. Joe Patla, announced the first batch of these hospitals that were exempted. We started at 37. Then within a period of 3 weeks, we managed to double the number into 72. So remember, we are working out of 212 hospitals, but these are spread across the country. But in terms of the priority, that is decided by the provinces themselves, because they know better which hospital is bigger than which one, and also in terms of the capacity and the type, the kind of specialized services that are rendered from one facility to another.
Yeah, but one would think that as soon as I am going to a hospital, I'm not going there for holiday. It means it is serious and my life is at risk, and hospitals should generally be seen as a priority. What's the difficulty?
No, definitely all the hospitals, but that does not mean that those who are not yet exempted, they are going to completely face a blackout, because we've got other alternative source of power supply, or our backup generators, our interrupted power system. So all those who are not yet exempted, we support them with other sources of power supply. So, but otherwise, at the end of the day, our intention as the Department of Health, working closely with Eskom technicians, is to ensure that almost all health facilities, from hospital to community health care worker to a normal clinic in a rural village like my village in Limpopo, is exempted from load shedding. But because of the current electricity configuration in some areas, it becomes more difficult for Eskom to immediately exclude one facility from the rest of Eskom clients.
So tell me, how have you approached that? I mean, have you gone back to the leadership of the various hospitals and said, readjust your budgets to be able to afford diesel? Are you going back to finance, treasury, asking for more money? Because I doubt that this falls within the budgets. I think in my conversation with, for example, Rahima Musa and Helen Joseph, their diesel bill shot up, at least in the last 2 months. And it's not something that is budgeted for. And they are saying they would have to compromise on other services because of that.
Definitely, almost all the hospitals and the provinces, they've depleted their budget for diesel, because we planned only for minor disruptions, 1 hour or 2 hour disruptions, not almost every day. But now, unfortunately, because of circumstances which are beyond our control, we end up seeing the country at level 6, which means the longer duration of a blackout. So that's why we had to assist the provinces, the hospitals, with additional resources to ensure that no hospital is going to close down precisely because of a blackout.
Yeah. So what are those additional resources? What does it look like?
Some of these resources, they include the budget, to ensure that we try to give them as much budget as possible, so that they continue to buy this diesel oil, and also the issue of maintenance, because not only about the diesel, because most of these generators were not designed to supply electricity during the blackout for a prolonged time. So we make sure that we bring more technicians to maintain them frequently than before, to ensure that during this difficult times, no generator is going to fail to kick in because of technical challenges. So we maintain them frequently than before.
Is there a long-term plan between yourselves as department nationally, but also provincially, to speak to either Eskom or the power suppliers in the various municipalities to create a way of isolating hospitals generally? Is that something that is difficult to do?
Definitely, in other areas it's easier, but in other areas, because of the way, especially because of the place in which some of these hospitals are located, they're embedded in a system where they're sharing the same network with the rest of Eskom clients, the community and other business, so which makes it difficult for Eskom to isolate one hospital which is located in the middle of a community or of a village. So that's why we also conducted what we call the network analysis, where we identified about 28 hospitals across the country which require a new network supply, meaning that we have to buy a separate transformer, the electricity. We reconfigure the current electricity line to ensure that they are removed from the rest of the other clients, which is going to make it easier for Eskom to exclude them during the time of load shedding.
And so going forward, because it does seem that the question of load shedding is going to be with us at least for another 24 months, if you listen to what is coming from Eskom. What's the plan for some of these high-risk emergency procedures that needs to be done?
So like the one that I've just given you now, is going to cost that about 100 million. The estimated cost about 100 million to exclude, completely exclude some of these hospitals from the rest of the clients. So this is a once-off fee which is going to assist us as government on a long period of time. But also we are exploring other avenues like your the solar panels, to ensure that some of these hospitals, especially the ones that are located in areas like Limpopo, Gauteng, Northern Cape, where there's it's very hot, where we'll be able to generate some of this power through the solar. So these are some of these alternative method of supplying energy that we're going to explore, working closely with Eskom and other public entities.
Foster, much appreciated, and thank you very much for coming on. Foster Mogale speaks for the Department of Health there on some of the plans and how they're responding, particularly to load shedding and adding more hospitals to that list of those hospitals which are exempted.